Hello, everyone. My name is Gillian, and I'm a medical social worker of Dover Park Hospice. The topic of our panel sharing today is We Grieve Too, the experiences of grief in a time of COVID-19. Today, we are privileged to have 4 members of our clinical team of Dover Park Hospice to share their experiences of working in a time of COVID-19, particularly on the topic of professional grief. Through this panel sharing, we hope that we can explore how even care professionals in the hospice setting need to acknowledge and recognize grief responses and what it means for them to grieve. Our panel of care professionals will share their grief experiences and how they cope as part of a larger community of caregivers in this time. So without further ado, let's welcome our panel of speakers today. We have Tang En, Chulin, Jasmine, and Xiao Wei. Can I invite each of them to introduce themselves to you, please?
Hello, my name is Chulin. I'm the spiritual care counselor at Dover Park Hospice. What this means is I journey with patients and their loved ones in the last part of their life. From my title, you might assume that a lot of the work that I do is religious. I assure you it is not. Part of it is, but part of it is really just exploring what brings people joy and what brings them fear or grief and how they make meaning of that. And a small part of my work is also to accompany my colleagues as we go through this journey together with our patients.
Hello, my name is Tang En. I'm a medical social worker in Dover Park Hospice home care team. Basically, what I do is I do home visits to our patients' home, provide psychosocial care. Sometimes we do casework and case management. Not sometimes, mostly all the time. But we also do psychosocial care and provide support to the family members. Yeah, thank you.
Hello, my name is Jasmine. I'm an occupational therapist at Dover Park Hospice. So as an OT, my role is mainly to facilitate engagement in meaningful activities, to improve our patients' quality of life, and also to enable them to still be able to live with dignity even till the end. Thank you.
Hello, my name is Xiao Wei. I'm one of the doctors in Dover Park Home Care team also. For me, like Tang En, I also do home visits with my nurses. We visit different patients to manage their medical conditions, their symptoms, as well as journeying with them through their disease and being with them even after. Thank you.
So thank you everyone for your introductions to our audience today. So we are very privileged to have them on board, and today I'll be the moderator of today's panel sharing. So just to start off, for our panel, perhaps I can ask a question. What do you think are the common misconceptions people have about grief and of care professionals? Would anyone be able to share your thoughts on this?
I can go. Sorry. Go ahead, Julie.
Okay, and then please jump in. I think there are 2 that come up very much. I've had loved ones, patients' loved ones, come and tell me, oh, it must be depressing to work here all the time because it is death, death, death. The other one that I think is implied, but it's not said so often, is we are professionals and therefore we see this all the time and therefore we don't feel things. Sorry, back to you, Tang En.
Almost similar. I think a lot of times I hear people say, oh, we are immune to it or we are used to it, so it doesn't affect us a lot. But in the process of getting immune to it, then we become we are noble people who are in this line. So I think these are the common misconceptions that people have about care professionals who also have grief. Yeah.
For me, right, actually it's a bit different. So we do have other friends who are also doctors in the medical community. A lot of them also did share that sometimes they don't really know how to, they want to cry with the family, but they feel that people expect them to be strong. So they need to be strong, be the one not to cry, be the one to really hold everything together. So that's one of the very common things that I always hear from my other friends in the medical field.
Yeah, I agree. I think sometimes, a lot of times, it's also people are curious about what we do. And I think it also swings between, like, we get questions like, oh, oh, you're very strong, or like, do you actually cry or not? So I think sometimes it's all these questions that people ask. And I think they're also genuinely curious about what we do. And I think through these questions, then they get to understand a bit more about all these common misconceptions in a way, I feel.
Oh wow! I think there's I hear some similarities and also some difference in experiences. Perhaps I might ask, what is it like for you to hear this from people, especially from your friends or loved ones? What is it like for you, and how do you make sense or even meaning from these responses as you work here?
Here I go. When people tell me that I am immune to their comments, but I'm not immune to my grief. Sometimes I just like, okay, I'm gonna shut off myself, because I think they don't really know what to say or what to comment, and they're genuinely curious. When at the time I try to explain to them, but otherwise, I think I keep doing my job, Yeah, so I'm immune to those comments.
For me to answer Chu Ling's question, because she did mention about how people share that sometimes is our job very depressing. That's something we really often hear. I always tell them actually no. In fact, I feel that in palliative care, you see one of the most happiest people around, not just patients as well as the staff also, mainly because of the kind of care that we provide, the kind of things that we do, how we change our focus towards really having a good quality of life. At the same time, I also do share with them that every single patient is different. Every single journey that we go through, of course, when they deteriorate, when they pass away, we also feel sad. But it's not something that is constantly on our mind that we just feel sad, but more so that this whole journey, we do reflect back on that whole journey with them instead.
Yeah, I also have friends who also do reflect back to me when they find out that our setting is one that normally accepts patients that are a bit more terminal, and they have this perception that it's a very sad place and like the work that we do is very sad. But actually, sometimes I also explain to them that I feel that even as we grieve, sometimes it's just finding the comfort in knowing like the difference that we make in their lives, and also that we did our best in giving them a good quality of life while they're here with us. And sometimes I think it also helps that because we know that in this setting, it's kind of like the end goal. We do know like what's the end goal in mind. In a way, we know that most of our patients that come here will eventually also pass on over here. And I think that mindset also helps prepare us a bit better, for their eventual demise and how we make the best of their time over here as well.
I guess like it sort of depends on how much energy that I have. If I'm feeling particularly cheeky, it's an opportunity to turn the question back on friends who say such things. Have you written a will? Does anybody know what your wishes are? But that's really only with people that we have a fairly good relationship with. And I think the answer for myself is really to appreciate the honesty of the work, because like Jasmine said, we know what the end game is, and nobody gets to run away from that. And in a way, it's a huge privilege to come to work and be reminded this is what is there for my patients. This is eventually going to be what is there for me, and to sort of hold that and ask myself the question. So, how do I want to live now? How do I want to live differently?
So I'm hearing that a purpose, being focused on a very singular purpose of wanting to be fruitful, or even redirecting that purpose to something like, oh, how can I educate my loved ones when they have, or my friends when they have these responses towards me. So my curious question is this, Xiaowei mentioned something quite interesting. In hospice, you see some of the happiest people around. Jasmine also shared a very similar sentiment. Of how you could still go on, to present, a very genuine, I suppose, connection with the patient, and that kind of give you to keep you going. How do you think, your own sense of grief when you when you lose that connection, in the sense that when a patient passes away, how and then a new one comes in and you rebuild a connection with that? How do you think that coexists with this happiness that you do present, or this a sense of purpose? How does these two, actually correlate or coexist with each other in your work? I'm very curious about that.
Okay, I can go. This is like the fastest finger. Click on unmute first. I think, to me, when a patient pass on, it is a physical loss of a person. Like, physically, this person is no longer there. But I don't think that we lose the connection with the patient, especially when we journey with them for quite some time. The patient's personality, values, the legacy that they leave with us will always stay. And sometimes when because we do a lot of home visits, so sometimes when I pass by certain blocks, I'm reminded of the patients who stay in this particular block. So I think that kind of connection is very transcendental. It's almost spiritual to me. Yeah. So I don't think it's a loss of connection. I think it's a continuous kind of bond that we have, a continuing bond, between the patient and me.
That also reminds me of, like, a patient that affects my practice, and I suspect each of us has a patient or two that we think about, not just when we pass the block, but also to sort of go, oh, I work this way because I had this encounter with this patient. So very briefly, this was a patient that I encountered when I was doing my internship. It was a acute care setting, so dying is very different. And it was a very, very traumatic death for the family lah. And it was, and this person I'm very, very grateful for. I think about them about the time that they die every year, because it was from this person that I learned about, what is a human emotion and what it means to allow myself to be there for the grief of that family and to be there for the grief of myself. I don't know that person. I knew that person when they were already unconscious. I had contact of an hour, right? But to sort of go, oh, this is a very human thing, and I must allow it. Otherwise, I'm not particularly human myself. Is one of my continuing bonds.
What do you all think about this continuing bonds concept that Tang En and Chulin brought up? Do all of you agree, or you would have your own sentiments about it? Because maybe not everyone think of it as connection. Maybe, if we think about it from a loss aspect, it's not only a loss of connection, but perhaps other losses as well. So I'm not sure. What does Xiaowei or Jasmine think about what Tang En and Chulin has shared?
I wanted to say that Tang En really puts it very well, because I was thinking, how do I express it in words? And after she said that, I was like, yeah, exactly. Because exactly what she said, when a patient passes away, and especially for us, we do see many people. So when patients pass away, almost immediately, or even during the dying process, you will also get new patients that are coming to you. So it's a never-ending process. And sometimes initially I do wonder, then how do we then grieve first for that patient who's dying, for that patient who has passed away, and then yet form another new bond? But after Tangan put it down in words, right, I was like, oh yeah, that's true. I actually still remember all our patients with all the different journeys that we go through with them. When we go to a certain block, we're like, oh, that's the block. Then I wonder how this person is doing. Even their family members. It's not just patients alone, but and the things that we remember of them. Like one of our patients was really good at making Hainanese food. So things like that. That every time I will still think about it when I eat certain food. Oh yeah, I remember that's what she used to do. At the same time, it's also family members. Like when we see similar family members in other patients, like currently we do have a family member who likes certain things done in certain ways, which I thought was very interesting. But then it immediately let me thought of another patient in the past where we're like, oh yeah, the other patient's family member also did similar things, and that's how we think back on our patients. At the same time, really about what they teach us, because our patients do teach us many things. Like what Chuling said, that how our practices change, right? I also learned that as time passes, as I meet more and more people, we do need to know that our patients really, really come first. It's not about what you think is the best for them, but what they think is the best for them, and how we can then accommodate them, how we can then work with them to really give them the quality, the kind of care preferences that they are looking for. Yeah.
Yeah, actually, I also agree as I was listening to everything. I think just now also what Tangan mentioned about legacy, I think that's really true. I think a lot of times it's really like the time spent with our patients, and through all these maybe informal sessions, like the things that they kind of like teach us in a way as well, maybe unintentionally, but in a way, through this journey with them, we also like develop self-growth at the same time. Yeah, and also I think sometimes it's also acknowledging all these grief emotions when patients pass on. And sometimes I feel like it's also difficult to find like the right balance in grieving in a way. Yeah, but I feel over time, as we work more in this palliative care field, we kind of also find our ways in a sense to try and prevent like huge swings in grieving. In a sense, grieving as a process, it will kind of always oscillate. It's hard to find like the right balance, but what we can do as we grow and as we learn is to kind of prevent like huge swings in a sense that might impact on us in a way. Yeah, and I feel that really comes from all interactions from our patients as we learn and as we grow together in a way.
Can I just add on a little bit to the continuing bond since we're here? Because to me, that connection, I have a very very good example of what is a continuing bond between my patient and I. So this was 4 years ago. My patient and I were communicating with a translator because she speaks Teochew and I cannot understand any of it. But with the translator, I managed to understand what she was trying to tell me. So we were talking about food. We were just talking, and then she said that life and being a human, you must be like a chong, which is a spring onion. So I'm like, why spring onion? Like it's out of the blue. And she said, when you look at the spring onion has a hole in between, right? It's not, you can see through that hole. And so she said that we must be like spring onion because we need to see through things. In Chinese, she said 看得开. You must be able to 看得开. So whenever I eat spring onion, I'm reminded of her. But it is not the spring onion that she left a legacy. It is her value. And the value that she taught me, that we must see through things and not get too stuck in there. Yeah, so I think this is an example of a continuing bond until today, 4 years later. Yeah, thanks.
I think that's really a very interesting and of course very perceptive insight, continuing bonds, because oftentimes when we talk about continuing bonds as professionals, helping professionals, we often translate it into the work that we do for our patients. We talk about legacy work. What would you like to leave behind? How can we facilitate that process? So speaking about our our own grief as professionals in that aspect, right? Because we have continuing bonds with the patient, it sounds almost very personal, like for Chang En, this value of this patient continues to be very close to her heart even after 4 years. So I have a question. Do you think there is a difference between so-called professional grief that comes from professional work, and grief from your own personal experience, like the loss of an actual loved one? Do you think there's a difference? And how do you differentiate? Do you even think there is a need to differentiate? So I'm not sure. What do you think?
Is it fastest fingers first or the brain faster first?
Anything. the fastest mouth first.
Okay, I go. I think as much as would not like to differentiate, there is a difference, but it's almost impossible, because if it's my loved ones, it is a different relationship, and relationships has nuances, right? Even if someone that I love passes away, someone who loved this person would have a different grief than me, even though it was a personal grief. And so I think personal grief and professional grief have some nuances in that. But the way we express our grief may have some similarities. Like if I like to do art, or if I like to sweat it out, I may do that even when I lose a loved ones. Similar to a professional grief. Yeah. So I think there is some differences, and also somewhat the expression of it somewhat similar. Yeah.
I think one thing that I would just like to also bring up is maybe a bit of transference sometimes. Like, even though you know that having your own loved one pass away is very different from having someone that you really journey with and take care of pass away. But yet, on the other hand, if let's say the demographics are very similar, either similar age, somebody close to you, or somebody close to your own age even, when they pass away, sometimes you also grieve a little differently. I feel sometimes it might be a little personal lah.
I feel, for myself, I feel that in a sense there is a bit of a difference between professional or grief that came from a professional setting versus a personal setting. I think maybe because from a professional setting, maybe the attachment or the bond that or the work that we do with them might be more of, let's say, like a caregiver kind, as compared to maybe if it was a personal relationship, I might not be playing, like, say, a caregiver role as much, in a way. So I think that might also impact on the kind of attachment that is formed. Yeah, but I do agree that we still all feel grief, and I think like what Tanga mentioned, the way we express that grief is probably same, yeah, regardless of whether it came from a personal or professional setting. Yeah, but I feel that the type of grief, I guess, is a bit different in that way, because it kind of came differently. Yeah, that's my thoughts. Yeah.
I guess for me, I hold sort of like a tension between sort of two sets of values. One is that I'm a human before I'm a clinician, and I tell myself that to remind myself that I cannot be afraid of my feelings. So I am personally extremely irritated with the idea that professionals cannot have feelings, because we're humans before we are any kind of professional. And I think to a certain extent, if we can't feel our feelings, then we're not very good at what we do. But also, how do I sort of right side the expression, right? Because, in my relationship with the patient or with the loved ones, I have a job to do. So is to sort of say, I take my expressions back to a place that is safe, whether it's my colleagues or my therapist or some of my loved ones. And I don't let my patients take care of me, and I don't like let it get in the, or I try very hard not to let that get in the way of my professional relationship with the people that I care for.
So that's really interesting what you brought up. You said you don't let it get to you. So I'm just wondering, has there been any time, any time where you actually felt that the grief has gotten to you, and and how did that look like at that time? How did the grief presented, to you, and how did you um cope with it to be able to continue on to work? Otherwise you won't be here. I safely assume that, are you still coping with it, or maybe you've coped with it and found a way to manage. So I wonder, how did that look like to you, your grief, and did it stop you at any point in time, and perhaps even to a point of crippling you, and what was that experience like?
I guess this is sort of a good time to sort of talk about support networks, because I think grief is the sort of thing that is very easy to, like, it can be very overwhelming. It can be quite crippling for some people. So then for me, an important part of my support network is to have people around me that I trust, right? Because when I'm at sort of like teetering at the edge, I already cannot trust my judgment to say, oh, something terrible is happening inside of me, and I need people around me to sort of go, Julian, maybe you really should go and take a break, right? And to sort of get perspective from other people. So I'm thinking about a patient who I saw very, very early on in my training, and he was a really, really lovely man. And I came back um, from one weekend having found out that he had died quite suddenly. And I went to tell my supervisor. I was lying on the beach, and I sort of saw his name floating across the clouds. Am I going crazy? Right? And he was like, no, this is completely normal. This is a mark of the relationship that you had, and you shouldn't be afraid of that. And I needed to be able to trust my supervisor, to be able to tell him that, and to trust the answer that he had for me. So then I could sort of like right sight it and sort of go, okay, that's all right then. So I think over here I rely a lot on my colleagues to sort of go, hey, I just had this experience, can I talk this out with you? And for most part, that helps me to sort of take it down a notch. Somebody just needs to hear that, I've had a relationship with this person. I'm now sad that the relationship is different, and then I can carry on. And I trust my colleagues enough to sort of go, when it's much more than that, somebody will tell me. And then we can sort of plot and say, maybe I should get an urgent phone call with my therapist, for example. So I think that relationship of trust is super important for me.
So how about the rest? I hear contemplative silence. That's a good thing. What did your grief look like at that time for you, when it didn't feel like you could, manage? I'm curious about that, because we began the conversation with starting to say, people thought that we are strong, that we don't experience grief like personally at a personal level, and that people think that we can still go on our day, after witnessing so many deaths, even a couple of deaths, then compounded over time, weeks, months, especially in the time of COVID-19, where I think our home care experiences and inpatient experiences has vastly changed, not just because of the different restrictions imposed on our daily lives in terms of our professional lives, but also the very quick adjustments that we have to make. So in a time of in our work that already experienced losses, on quite a daily basis, or grief, not just of ourselves, but of witnessing for others, how about, in the greater scheme of COVID-19? Yeah. Were there ever a time where your own grief reactions and responses, along with the changes of the world, the season of, the pandemic season, how did that look like for you? And how, were there any way that, you can suggest that, to overcome or to manage it?
I think grief comes in many forms. It is especially challenging in times of COVID-19. And I don't think my question is not how to overcome. My question is, can we embrace them? Can we look at them with kindness and compassion? Because I think in home care, a lot of feelings come together at the same time: frustration and regrets, or feeling guilty. And they are not mutually exclusive, right? They come all together, intersecting. And when we go for home visits, we know there are helpers in the household, domestic helper, and we know they come from countries like Indonesia, Myanmar, and COVID-19 is just so widespread in their country. And I have like family members whose helper, the helper's family member actually passed away due to COVID in their country. And then that kind of vicarious trauma that passed on to their family passing on to us, right? It's kind of like we feel it, we feel their grief. It's like a collective grief, right? And then we have to like support the helpers, the domestic helpers and the family in that context, right? So we don't directly, we are affected by COVID, but our death rate is not as high as other countries. And that is our privilege. So I think along the way we journey with this group of people during this time is especially challenging. What can you tell them when they cannot go back home? They can only video call perhaps, right? And that kind of grief support for them, especially when patients are quite ill and then when they pass on, and then how do you then continue to support the helper, for example? Yeah, it's still a very, very challenging area to work in. Yeah.
How about the rest? How do you think COVID-19 has changed in the way you observe of your own grief reactions in your otherwise, normal day-to-day work versus today? What do you think you observe about yourself or of your colleagues around you?
I think in this COVID-19 period, right, it changes a lot of things at the end of life, because when before that I was in the hospital, everyone could come when somebody was very ill. We could actually get all the families to come. They could stay overnight. All these are very common things that you see all the time. But with this pandemic, really people are not able to visit the hospital. People don't want to go into a hospital. Even visiting at home, you do see family members asking you, are we all able to come? Will the safe distancing ambassadors come and suddenly say that we can't have more than so many family members coming in? So these are really things that sometimes I do feel helpless sometimes. That's really a term to describe lah. To some extent, you can always write something for them, do something for them, but that's only so much, because ultimately it's not something that is within your control. Or even recently we do have patients, because at home more and more people want to be at home, yet at the same time not everyone can cope at home. But when we talk about coming into inpatient hospice and all, we must also wonder about whether the visitation policies and all this will also affect our family members. So these are things that I do feel that is really changing a lot because of this COVID period lah. And a lot of times, while you really empathize with the family, but ultimately with public safety and all, is really very hard to also bend your way around. Yeah.
I also feel that with this COVID-19 situation, even us ourselves as professionals, it kind of also has affected the way that we grieve together in a sense. Yeah, because like maybe previously, before COVID-19, we were all able to have like face-to-face meetings and things like that. But I think one thing quite prevalent with COVID-19 is the rise of social isolation in a way. Yeah, I guess not just in personal life, but also in like work relationships, because we might not be able to meet each other as much, or to establish like relationships and bonds at work that we could previously were able to do. Yeah, so I think it does like require that extra effort in a sense to kind of like step up, to reach out to each other, to check in on each other, whether we are okay. And in a way, that has also kind of moved to a different platform, like a more online platform, where people or like teams are even able to gather, because like maybe COVID-19 might have changed even the way we practice. We might have had to like move towards split teams and things like that. Yeah, and I think even that effort of still engaging each other and kind of being there for each other, but maybe in a different way, because we might not be able to be physically there for each other. So I think that, yeah, that is something that COVID-19 has kind of also impacted, I guess, in the way we practice ourselves, or even among like colleagues and among our teams. Yeah.
So thanks for sharing that, Jasmine. I think that's really important, and also to Xiaowei for highlighting the sense of helplessness, and also Jasmine highlighting isolation, which are all very real problems even amongst the helping professionals. So we talked about support. We talked about trying to find ways to help the patients despite the lesser resources to do so. How do you think that has impacted on your own grief reactions? And were the support, for you sufficient, even if we've been trying so hard to support each other in this time? What are your thoughts on this?
I feel that one thing good about like our setting or Dover Park in a way is the access to like the counseling sessions, and also just as a culture, there isn't that stigma towards like if we are going for counseling, and there might be something wrong with you and things like that. But I feel that in a way, as a whole, we kind of encourage it, so that it kind of provides a platform, maybe with someone external, to help us process our feelings, and also process our feelings of grief. Yeah, and being able to feel safe in a way. Yeah, so I think that is something that I appreciate as well, in a sense. Yeah.
For me, I think it's really good that home care, we really work as a team, where we have our nurses, our social workers, everyone is in the team. And very often, everybody will ask each other how you're doing, because we do see the same patients. So, for example, Tang En will always come out and ask us, even just a simple text and all, will just say anytime you are not feeling okay, and or you can just approach her. So I think all these are really very helpful. And we do have all the psychosocial sessions once a month, where we discuss about different patients, and really how do we reflect back on our care for them, how we journey with them. And I thought all these are really very helpful for us.
I agree with Xiaowei and Jasmine. The part on peer support is very important, and I think really a privilege to be part of the home care team, where every week we have our multidisciplinary rounds, and we really have moment of like silence to kind of like just pay tribute to patients who have passed on within the week, and really talk about the case and their family, and really from that, right, it in itself is a continuing bond. Right. So, and I agree with Jasmine that part on going to see a therapist. For me, I see a psychotherapist, and it's very frequent. And I find it very, very helpful for me to process that kind of professional grief and how it relates to personal grief or personal life. So I think it's a duality, it's a dual process. One cannot exist the other. Work is part of my life, right? So that comes in together, lah. Yeah.
And I also feel like there is the power of like collective grieving, in a sense. Yeah. And I feel that like recently as well, like over at the inpatient side, we also started to implement something called the honor walk, where as all the healthcare professionals, we kind of like line up the pathway as we push the patient towards the lying in room. And I feel that that in itself is very powerful, and it kind of sums up, I guess, our journey with the patient in a sense, and it kind of allows us to grieve together, and like know that we are like, it's kind of like a shared experience in a way. And I feel that in itself is is very strong. Yeah, and it kind of just helps with the grieving process and knowing that we are not alone, and we are not the only one that are feeling such emotions, and that it's okay to cry, it's okay to cry together, and okay to be vulnerable in front of each other. Yeah.
I was quite surprised by the honor walk, as in, like, I've sometimes come and joined the honor walk for patients that I haven't yet seen, and there's still that sense of sort of just being there at the very end of somebody's life, and it's just an opportunity to value that person as a person, whether or not I've had a relationship with them. So that's been really, I think, I join when I can, because it's as Jasmine says, it honors the person, it honors the relationships that are present here. And I think part of what Jasmine was saying is also the modeling, right? As in, like, we're not waiting for the social workers to start feeling emotions. Everybody in the hospice who wants to can, and they do. And I think that's super important, because it doesn't feel like we're spotlighting a person to do the feeling for us. So that is, I think, one form of support that's quite informal, but that's also quite important. But, like, I also wanted to say, because COVID makes everything difficult, right? So it's not just care professionals who are looking for therapists nowadays. Everybody is looking for therapists. So sometimes just finding somebody that you click with and getting an appointment that's not 6 weeks down the road is like a whole thing in itself. So then, like, speaking for myself, everything becomes a little bit more difficult, because I have COVID fatigue, so I don't want to pick up the phone. So then it's not 6 weeks down the line, it's an appointment 8 weeks down the line. And then, like, we have all these COVID rules, so all my informal coping becomes harder, because I cannot bring myself to ask a friend who has children to say, can I come and play with your kids, so that I am reminded that there's more to life than work, right? Because government say 5 people only ma, and then I work in healthcare. I don't know whether you're pantang, but I think in bits and pieces, whatever I can get myself to get to is good enough until I find the energy to do a bit more lah.
So when resources are scarce, as what Chulin said, how do you think we can then manage, because when we talk about grieving, right now we're talking about, in a time of COVID-19 in the hospice setting, we are sharing our experiences, but I also think about the professional caregivers out there in the community, in the hospitals, at the front line, or even in very unseen parts of caregiving. I'm sure there are lots out there wearing these types of hats. And we are privileged to be given the acknowledgement that we do need, counseling services to support our staff, etc., etc. But when resources are scarce, what would be your how would you encourage, or what would you share with our colleagues out there? Yeah, what do you think has been helpful? What do you think will be helpful?
Very corny, yeah, but I think very effective. When you take an aeroplane, if anybody remembers what that is, when you take an aeroplane and they do the safety briefing, it's always put the oxygen mask on yourself first and then help the people around you. I don't like that image because it's very instrumental, but it's also true. We're not very good to anybody if we are a bit incapacitated, shall we say. So I think it's an image that works for some people, to sort of say it's not an indulgence to look after ourselves, right? A chef keeps their tools sharp, and so taking the time to look after our emotions and looking after our minds is not some sort of indulgent thing, but it's part of responsible professional behavior.
Continuing from what Chulin said about having our own oxygen, right? Sometimes I'm also aware that I'm running low. I need help. I need support, and I will go to someone and I'll lean in and say, I need some oxygen. You got some spare? So what I meant in literal in that sense is that I will lean into my colleagues or my friends, and I'll ask them, do you have some energy to spare me so I can share certain things? I need a space, right? So they will be my containers and anchors for a while, right? So I think it's also important not just to use when your oxygen run low, to be able to seek help and support that way, and not be ashamed or be stigmatized that you need it. I need it. Yeah.
Talking about stigma, I Jasmine mentioned something about vulnerability, having access to a team of supportive colleagues. And that's, from I guess our collective experience, that's been helpful, in this various way, the honor walk, the psychosocial sharing, debriefs, etc., etc. But I do also understand that there are, also people out there, because, we may wear a superhero, a complex, or a cape, invisible one in the back of our minds, because that's why most of us feel called to, to do the roles that we are doing now. So showing vulnerabilities might still be a very foreign concept to some. And Tangan mentions stigma, a therapist saying, a therapist, a doctor, oh wow, God forbid, is going to see a psychologist, or their own colleagues, a psychiatrist, I mean, I think it can, to some people, that can be a very scary thought, because we are professional, we are caregivers, there's so many labels that we wear and responsibilities. I cannot break down. Now, that is a very common sentiment that even caregivers in, taking care of a sick one in the family, in the home, they feel that they have to keep going. And I think a lot of the professionals have the same thoughts. But how would you share with someone, and, speaking to who have these kind of thoughts and feelings about, vulnerabilities, accessing support?
It sort of depends on where it comes from. So I'll speak very briefly. I think one of the narratives that comes out quite often, whether we're talking about loved ones, caregiving, or professional caregivers, is if I don't do it, who will? Where does that come from, right? And treat it, sort of talking about that with some amount of generosity, that some of this really does come from a place of care and concern. Nobody knows my loved one like I do. I have to sort of do it, right? And to sort of break that down, to sort of go, what is actually an acceptable level of care, so I as a caregiver can get some respite. That's kind of important. The other thing that I might suggest, and that's mostly because I am that kind of geek, learning a little bit more about the neurobiology of trauma and distress was really helpful for me, in the sense that it helped me to understand that this was biological, that I was not a weak person. Humans are wired to respond in particular ways. So when I am hypo aroused, which is like I'm very sian, right? Or if I'm very hyper aroused, where I'm like very, very attentive and sort of like slightly over functioning, it wasn't because I wasn't a well-adjusted person. It's because my biology is telling me there is something really stressful in my environment, and I should go and deal with that. Now, that's not going to work for everybody, but for some people it will. So I just want to put it out there.
For me, I just want to bring us back to the beginning when we first started this session. We said about we being a human being first before we are a professional. Just like a person is a person until this person is a patient, right? A person is a person until this person becomes a caregiver. It is a role. And our professional job title is also a role. But we are humans and we have emotions. And just like as humans, we always hear what you need to exercise to keep yourself healthy. That is a physical health. But when we talk about mental health, we also need to exercise our mental health. And that itself comes in a lot of forms. Some people like to sweat it out, but after sweating out, then what's next? How do you process, right? So just like you do physical exercise, how do you then recover? And so if I sweat it out, I need to recover, I need to heal. And where do I find that space? How can I go to my friend? And every time I go to my friend, I'll ask for 45 minutes of the time. I think that's not quite fair to other people as well. So to be mindful of that, I think that's where psychotherapists or counselors come in, where to go for a session, it means that I have 45 minutes or to an hour of my time. This is my space, and it's a safe space. And so that is in itself, I think, a mental health kind of exercise to keep my mental health healthy. Yeah.
So, by getting support for ourselves, both from organizational, resource wise, and also our own personal resources, I guess, we all have our own experiences of coping and managing our grief reactions. How do you think by being more aware, more intuitive, more self-aware of your grief reactions, especially in this time of COVID where resources can be harder and harder to find, that you're expected to hit the ground running harder than ever. How do you think your practice have changed? What have you learned about yourself?
I mean, for me, I feel that it's quite true that sometimes in this time when resources are more scarce, you can't really meet up with your friends, cause a lot of cross institutions and things like that. And there's really so much you can do over chatting on a text or via a phone call. So it's really about recognizing that, hey, maybe I'm tired, maybe it's time to take a break. And that's when I would then actively either inform my team or let's say our home care team that, hey, I think it's time I need a break. I'm going to take leave for a period of time. And usually when one of our team members do that, we try not to even contact them, and also it's really their own time to themselves, doing what they think is best for them to refresh themselves, to really rest and then come back again. Yeah.
How about the rest? Contemplative silence.
Actually, I find like personally wise, like because of COVID, then there has been many changes also, and I guess also adapting how I take care of myself or how I recharge in a sense, because like what Xiaowei mentioned, like we might not be able to meet with friends as often, we might not even be able to go out and exercise as much as we used to. So I think sometimes it's also finding or exploring other ways, new ways, yeah, which I think a lot of people has also been doing, like finding new hobbies or home baking and random things like that. Yeah, so I think in a way COVID has also encouraged a different kind of self-growth, because I guess because of these kind of circumstances, it kind of force us to kind of get out of our comfort zone, think out of the box to find other ways that we are able to recharge ourselves. And hopefully after this COVID period, we find ourselves even better equipped with newer ways or other ways that we find were helpful for ourselves along this journey. Yeah.
Can I just add to what Jasmine said? Yeah, so after what she said, it reminded me, because I remember that when we used to take leave, we usually go overseas. We usually really do take a leave for a purpose lah, in that sense. But yeah, like Julian's background. But then now when I remember at the start when I was tired, I would always think about, why do I need leave? I'm just in Singapore, you see, even with that leave, what am I going to do? And it makes me a bit reluctant to do that. But then now that it's been about 1 year, more than 1 year since, now I really take leave and really just spend that time with myself, being at home. Like, it's fine being in Singapore. You find other things that you like to do, take up different hobbies rather than really just think about my leave. I can't go overseas anyway. Why do I take it?
I think that's really important, because I think what Xiaowei shared, right? It just came to mind, So, like what Jasmine also mentions, the self growth thing. It's about being more conscious of even more conscious of making certain decisions that are important for you, even though you might not even realize it at that point. Because taking leave is such a intuitive thing in the past to just click and buy an air ticket and go somewhere, because Singapore is so easy and accessible, right? And it's a very subconscious effort. But more and more with the limited limitations in what we have, what we can access, the more creative we have to be, but also the more conscious we have to be in making certain choices. Why do I need this self-care? But also, do we have to be so burnt out to reach this stage? I think that is the greater question here. Is like, most of us hang on to the monkey bar until our arms are shaking and barely able to hold on, maybe just hanging on by just one little finger before we want to say, oh, I let go and I'll take one day off. Yeah. So what are your thoughts on that? Those hanging by the bar with just one little finger with barely a muscle energy left.
Got a few options. First, you can go to a monkey bar that is shorter, so you can stand on the ground and hold, not so tired. Or you find a step and then you hold the monkey bar. And then third option is when you hold the monkey bar, don't wait till fatigue. Don't wait till your muscles get fatigued and then you drop, right? You got to rest and then you hang again. But of course, hopefully, no need to hang. Why are we hanging? I also don't know. Right? Why are we hanging on to the monkey bar?
Superheroes, because we
We gotta
wear
move.
our
We
red
gotta move,
underwear
right?
outside.
Monkey bars for us to move from point to point. Yeah.
Exactly. It's like this superhero imagery, whether it's imposed on us or self-imposed, is super damaging, because that's not how we're wired. That's not how we survive. So I'm like, hang on the monkey bar for who to see? Um, the other thing is, I think there are some people's idea of resilience is how long can you endure, and then burn out, and then crispy chao ta already, then cannot come back lah. Then for what? But if we change our definition of resilience to include sustainability and recovery, then I think it's something that might be more nourishing for ourselves and nourishing for the communities that we say we want to work in lah. Because I think we need to sort of have a very clear view of who we are and what we can do. Can we do a lot of good in our positions? Yes. Yeah. But we're also incredibly expensive to resource, to train, to get the number of years of experience so that we're reasonably competent at what we do. So we sort of like stay 5 years in industry and get so crispy that we all go and do something else. Then are we fulfilling the initial hope that we have for ourselves when we join that? And that's a longer term question that I think we need to ask ourselves. But the community itself also needs to reflect on, because to a certain extent we can have policies that encourage us to take leave. But are there also other elements that support recovery rather than persistence, rather than hanging on, I think.
So I think that's really good to note that when we talk about burnout, we all often think in terms of being overworked, but the context of work, when we talk about grief, especially, it's not really just from what we have been sharing so far. We understand now that grief is not just about the loss of a patient. It's grief in the context of the environment, the world that we are living in, our own personal experiences of it, and then like what Tangan and Julian said, we are humans first. We experience the world, the work as humans first, rather than our professional title. So I think it is very important for us to be able to be aware of where our grief is really coming from, and what is it about. Yeah. So the awareness, sometimes we are not so aware. We need external support. Yeah. So coming back to this, also being aware of time, perhaps, I can perhaps each of you can share, what are some of the messages that you want to send out from your experiences of grief reactions, of grief responses, of coping, of your own colleagues even. What are some of the messages that you want to impress upon today, and or even maybe share something, a take-home message for yourself.
I think for me, as cliche as it sounds, is the idea that like it's okay not to be okay, and like to have compassion for ourselves and compassion for those around us, especially in these COVID-19 times, because things are different. And I think just that reassurance that it's okay, and it's okay to be kind to ourselves and kind of like put ourselves first, so that we can kind of be the better version of ourselves, so that we are better able to serve our patients whom we work with. Yeah, and also that it's okay to grieve. Yeah, everyone will grieve. Yeah, but I think more importantly is healthy grieving. Yeah, and being able to I guess seek support and grieve together. Yeah, I think that's something that's very important.
For me, I think one thing that I really learned out of this during this COVID situation really is to watch for one another. Really watch for one another. Sometimes somebody who's really grieving, somebody who's really burning out, they may not recognize that, or simply that exactly like what I used to think. Why do I take leave for, right? I can't even go overseas. So I think it's really important that during this period of time, we really watch out for one another. And sometimes it's good to just poke them very lightly and say, hey, I think you need a break, or even be the one to highlight it. Don't be afraid that, hey, what if I said something that they don't like, and or so. Then they may recognize that that's when you actually need a break. That's when you actually need to take care of yourself, or that's when I actually know that things are not looking too good. Yeah.
Somewhat in line, or actually, I'm in line with what Jasmine and Xiaowei has said. I think it's important to put ourselves first. The oxygen that Chulin actually gave, as an analogy. And I think it's important to really pause and ponder and then pivot, recharge and rejuvenate, and then come back to it. Yeah.
And I think on a slightly different note, I'm going to share my favorite quote from Winnie the Pooh, which I think some of you know. How lucky I am to have something that makes saying goodbye so hard. I think learning to be present with the grief, learning to see it as part of the journey of the relationship that I have, is something that's really important, to sort of say, oh, this is an exchange that we have with each other, and it's okay, and it's okay to share with other people. It's something that I want to be able to remember.
Okay, wow, thank you. I think that's I think there's a lot of deep sharing today, and certainly I think it comes a lot from our heart, because grieving is not easy, and it is a constant journey of relearning, unlearning, also unpacking, in that sense. So the journey doesn't end, it keeps going. Whether or not we work in this field. So I just like to thank our panelists today for your very authentic and wonderful sharing, for bravely, warming up and then bravely sharing your experiences and your thoughts. So I hope all of you, in the audience have enjoyed learning from them, from their thoughts and experiences like I did. So as professional caregivers, we constantly not just learn from our patients, but also of ourselves. So as Jasmine said, we learn to be compassionate with ourselves, just as we have been compassionate with other people, because we do deserve it. And even when there are times where we can't love ourselves, we need to know that there are people who still love us. So that said, we need to understand that we can learn to take care of ourselves so that we can learn to take better care of others. So with that, thank you for tuning in today and spending your time with us. As part of the Tapestries of Grieve Festival, there's a whole lineup of activities for you to access. So please do go to tapestriesofgrieve.com for more information. Yeah. So we wish you well and please keep safe.